Eat garlic, but never make these 6 mistakes. They can be fatal. Vertical bar senior health tips. Garlic has been celebrated for centuries as one of nature's most powerful healing foods. Rich in sulfur compounds like allicin, as well as antioxidants, vitamins, and minerals, garlic is often regarded as both a culinary treasure and a natural medicine. It has been linked to improved heart health, reduced blood pressure, stronger immunity, and even protection against certain infections. For seniors in particular, garlic holds special benefits. It can support cardiovascular health, improve circulation, and help reduce inflammation that contributes to chronic diseases. However, despite its reputation as a superfood, garlic is not without risks. When consumed incorrectly or in excessive amounts, garlic can cause serious problems. For older adults who may already be taking medications or dealing with age-related health concerns, these mistakes can even be fatal. This guide explores 6 common mistakes seniors should avoid when consuming garlic. By understanding these risks, one can continue to enjoy garlic safely while maximizing its benefits. The importance of garlic for seniors. Before diving into the mistakes, it is worth reflecting on why garlic is so widely recommended for people over 60. Scientific studies have shown that garlic may lower high blood pressure, reducing the risk of stroke and heart attack, improve cholesterol levels by lowering LDL bad cholesterol, act as a natural blood thinner, reducing clot formation, provide antibacterial and antiviral protection, strengthen bones by increasing estrogen in women after menopause, support brain health through antioxidant and anti-inflammatory properties. Clearly, garlic is an extraordinary food. Yet, as with any natural remedy, balance, timing, and awareness of interactions are critical. Mistake #1. Eating garlic on an empty stomach without medical guidance. Many people believe that eating raw garlic first thing in the morning maximizes its health benefits. While garlic does have stronger effects when eaten raw and on an empty stomach, this practice can irritate the digestive system, especially for seniors with sensitive stomach linings. Garlic contains sulfur compounds that are highly potent. When consumed without food, these compounds may lead to stomach burning, nausea, bloating, or acid reflux. Seniors who already suffer from gastritis, ulcers, or irritable bowel conditions may experience worsened symptoms. In extreme cases, chronic irritation could increase the risk of gastrointestinal bleeding, especially for those on blood-thinning medications. It is safer for older adults to consume garlic with meals rather than on an empty stomach unless advised otherwise by a healthcare professional. Mistake #2. Overeating garlic in the name of more is better. Garlic is often treated like a magic bullet for health, leading some to believe that higher amounts mean greater benefits. However, garlic's active compounds are powerful chemicals that can overwhelm the body when consumed excessively. For seniors, eating too much garlic may cause severe digestive upset, including diarrhea and cramping, excessive blood thinning, which raises the risk of dangerous internal bleeding, dizziness or fatigue due to sudden drops in blood pressure, toxic effects on the liver when consumed in extreme doses over time. The recommended safe amount is generally 1 to 2 cloves of raw garlic per day, or a moderate amount in cooked form. Going beyond this can stress the body rather than heal it. Seniors who may already have weakened systems should be especially careful not to overindulge. Mistake #3. Mixing garlic with blood-thinning or heart medications. One of the most serious risks for older adults is the interaction between garlic and common medications. Garlic naturally thins the blood, which can be beneficial for reducing clot risk. However, when combined with prescribed blood thinners, such as warfarin, aspirin, or clopidogrel, the effect can be dangerously amplified. This may lead to uncontrollable bleeding, nosebleeds, or even internal hemorrhages. In surgical situations, excessive garlic consumption before an operation can increase the risk of severe blood loss. Garlic may also interact with medications for blood pressure, causing levels to drop too low. Seniors taking heart medications, cholesterol drugs, or diabetes medicines should consult a doctor before significantly increasing garlic intake. Mistake #4. Using garlic supplements without monitoring. Garlic supplements, whether in pill, capsule, or oil form, are often marketed as safer and more convenient alternatives to fresh garlic. However, these supplements vary widely in concentration and may deliver higher doses than expected. For seniors, this poses several risks. Overdose is more likely since supplements can contain concentrated allicin or aged garlic extract. The body may react differently to processed garlic than to fresh cloves, leading to unpredictable side effects. Supplements can interfere with the absorption of certain medications. In some cases, garlic supplements may even contain additives or fillers that weaken their safety. While fresh garlic is usually the better option, supplements should only be used under medical supervision. Mistake hash 5. Eating garlic before surgery or medical procedures. Garlic's blood-thinning properties are useful for heart protection, but can be dangerous before surgery. Seniors scheduled for any type of medical procedure, whether dental surgery, cataract removal, or major operations, should avoid garlic in the days leading up to the event. Even moderate garlic consumption can increase bleeding risk during and after surgery, making recovery more complicated. Doctors often recommend stopping garlic intake at least 7 to 10 days before any scheduled procedure. Ignoring this advice could result in excessive bleeding or delayed healing. Mistake hash 6. Ignoring garlic allergies or skin reactions. Although relatively rare, garlic allergies do exist, and seniors may become more sensitive to foods as they age. Symptoms of garlic intolerance or allergy may include skin rashes or eczema when handling raw garlic, respiratory issues such as asthma flare-ups, digestive discomfort beyond normal bloating, severe reactions like swelling of the throat or difficulty breathing though uncommon. For those with sensitive skin, even handling garlic during food preparation may cause burns or rashes. This is due to the strong sulfur compounds that can irritate the skin. Seniors should wear gloves when preparing garlic if irritation occurs and avoid consuming it if any allergic signs appear. Safe ways for seniors to enjoy garlic. Avoiding these mistakes does not mean seniors should give up garlic. Instead, the goal is to use garlic wisely and safely. Here are some tips. Cook garlic lightly. Cooking reduces its harshness on the stomach while still retaining many health benefits. Adding it to soups, stews, or roasted dishes makes it easier to digest. Pair garlic with other foods. Eating garlic with olive oil, yogurt, or vegetables can balance its effects and reduce stomach irritation. Limit the quantity. Stick to 1 to 2 cloves of fresh garlic daily or moderate amounts in cooked meals. Monitor blood pressure and bleeding. Seniors on medication should keep track of their health and inform doctors about garlic intake. Consult healthcare professionals before taking supplements or drastically increasing garlic intake. Always seek medical advice. The double-edged sword of garlic. Garlic is a double-edged sword for health. On one side, it offers powerful protection against many age-related diseases. On the other, careless consumption can lead to severe complications. For seniors, whose bodies may already be vulnerable, this balance is especially important. The 6 mistakes: eating garlic on an empty stomach, overeating, mixing with medications, relying on supplements without monitoring, consuming it before surgery, and ignoring allergies can all have dangerous consequences. Avoiding these pitfalls ensures that garlic remains a healing food rather than a harmful one. Conclusion: garlic is one of the most remarkable natural remedies available, with a history rooted in both medicine and cuisine. For seniors, it can offer real protection against cardiovascular disease, infections, and inflammation. However, it must be treated with the respect it deserves. By avoiding common mistakes and understanding the risks, seniors can continue to enjoy garlic safely while protecting their health. Like any powerful remedy, garlic works best when used wisely, in moderation, and with awareness of individual health needs.